My name is Dr. Sean Joseph. I'm a chiropractor with Integrated Chiropractic at Silverdale Wellness Center. I am a chiropractic physician and a certified kinesiotaping practitioner. Today I'll be talking about post-injury assessment and how important it is to get seen by one of us after you hurt yourself. Just to let you guys know, we're here to help you. So something that we cover with a lot of our athletes is that we're here to make sure that you can get back and play and get into the field as quickly as possible. So make sure that when you do have an injury or have something that's questionable, that you do bring it to one of our attention so we can clear you as fast as possible. The one thing we don't want is you to get re-injured or to do something that would make that injury even worse and make you unable to play. One thing I want to cover is icing is really important after your initial injury, up to 2 to 3 days. Ice is really important. If you were to heat will make inflammation worse. So you want to make sure that you're icing for at least 20 minutes, taking an hour off, and you can repeat that cycle as often as you can. An easy way to remember treating inflammatory issues or anything with pain is RICE. RICE stands for rest, ice, compression, and elevation. We recommend elevating the injured area above the heart, but we want to make sure that when you do this, you're icing no more than 20 minutes. And again, you are resting after that for at least 60 minutes. If you decide to take anti-inflammatories like ibuprofen or Motrin or Tylenol, which is more of a pain medicine than an anti-inflammatory, just make sure that you would take the advice of a health professional first before you take that medication, so you make sure you're not overtaking just because of the side effects that you could occur or that could occur. You want to make sure that you're taking the right dosage. Outside of that, there are natural things that you can do and you can use. Ice is always the #1 suggestion, but there are supplements out there that you can use, such as arnica or turmeric or bromelain. Those are things that you can get that are natural and over the counter, as well as those anti-inflammatory medications. One thing that we are a firm believer in is making sure that you get the care that you need. So when you do get seen by either one of the physical therapists, by the chiropractors, make sure that there is a protocol put together so we can continue to manage your care, whether it be at the physical therapy office, whether it be at the Silverdale Wellness Center office, or a combination of the two. We want to make sure that you are treated and seen and get back into the field as quickly as possible, injury-free. My name is Dr. Sean Joseph from Integrated Chiropractic at Silverdale Wellness Center. I am a chiropractic physician and a certified kinesiotaping practitioner. And what I'm going to talk about now is neck and back health. So right now what I would like to talk to you about is what's most important, which comes down to postures. And so things that you don't think about doing when you sit, sleep, and stand, those are things that I want to make sure that I cover with you guys. When you go ahead and do something like sitting, and you would go ahead and go into a position where you're rounding your back or your head goes forward, those are things that we want to avoid. We want things to be something that is going to be more productive for the curves of your spine. You have curves in your spine on purpose to cause shock absorption ability in your spine. And without having those curves, you're going to lose that ability to absorb that shock in your spine over time and as you get older. So by watching how you sit, sleep, and stand, those are things that we'll be able to look at and make sure that that alignment is accurate. For instance, when you stand, you want to make sure that certain things are in a symmetry. Symmetry is really important to what we're looking for. As chiropractors, we look for symmetry all day long. That's what we're looking for. Everything needs to be even and symmetrical. And so when it comes down to posture, the same thing goes when you sit, sleep, and stand. Your bodies like to be symmetrical, your bodies like to be even. So when it starts to fall off of that is when you start to find that you'll start getting compensation from other tissues and other things. So for instance, I'm gonna have Liz Oba come on forward, and then as she's facing forward, we can get people that would end up finding that they will lean on one side more. So if she was to lean onto one side, you can see how the weight distribution will shift over, and that weight distribution will cause more concentration on her right side of her body. So there will be a compensation by her spine, by her pelvis, and even the lower leg. So there's something called the kinetic chain. That kinetic chain is from the ground up. So it will affect the ankle, it'll affect the knee, it'll affect the hip, and eventually affect the pelvis. So in this instance, it would be her right leg that would be gaining more of the weight bear, and then therefore working up the right leg and into the pelvis and potentially creating back problems that way if there was a problem in that lower extremity. And if she was to balance back out in center, everything should be even with the navel, which is the belly button. So if you were to come up from the belly button should line up with the center of the sternum, which is obviously lining up with the center of the chin, and then the nose. And this would be your symmetrical position facing forward. And if Liz was going to face to the right, this way here, you can see this is the proper positioning to be in, where you have the external auditory meatus, which is the whole of the ear, is lined up with the front of the shoulder. And the front of the shoulder is then lined up with the side of the hip, then is lined up with the knee, and then is lined up with the ankle. And this is the proper positioning. If we get someone that has the typical human position, which is rolled shoulders, as you roll your shoulders forward, the head will then go forward following those shoulders. Those are things that we're trying to avoid, because that is then going to change the way that the spine absorbs that force by just changing the way that the balance or the gravitational balance is in the spine. So in this case, if she was to bring her shoulder blades back and down, and then just allow that the whole of the ear lining up with the front of the shoulder, that would be accurate for the upper neck. For the lower back, what we tell patients is making sure that they don't have too much of a sway back or too much of a no back. So we call this hypolordosis when you have no curve, hyperlordosis when you have too much curve. In this case, what we want to have is want to have a neutral pelvis, which is exactly what Liz has now. And in that position, the best way to do that is by pulling in your belly button and tipping your pelvis backwards by contracting your glutes. If you were to be able to do that subconsciously, that there would allow for the curvature of the lordosis to continue. Thanks, Liz.
You're welcome.
So the idea here is to make sure that you continue to, one, if you were to sit, you sit in a symmetrical position. If you like to cross your legs, you have to make sure that you cross your legs 50% of the time on both sides, or you just don't do it at all. You have to make sure there's a symmetry being taken place, otherwise you're going to end up having compensation. When you sleep, stomach sleeping and sleeping with one leg higher than the other, those are two things that are very common in people who sleep and then contract something like back pain. Back pain can be something that is very common from having hamstring length shortening, from having glute issues, to having low back tightness. All of that will take place and concentrate in your pelvis, and that pelvis will then lose its neutrality and changing from going to either a frontwards tip or a backwards tip. So when you're sleeping on your back, make sure that if you do have back pain, we're taking the slack out of your hamstrings by putting a pillow underneath your knees when you're on your back. And if you're on your side, you're putting a pillow between your knees to keep your knees hips width apart. You don't want your knees too close together, and you don't want your knees one higher than the other. That will end up causing some issues, especially if you're having back pain. But good behavior while you sit, sleep, and stand, for instance, when you stand in that symmetrical position, when you sit in that symmetrical position, and when you sleep either on your side or your back, you're making sure that you respect those postures and those curves that you need in your back in order to take in that shock. So if you guys need anything, let us know. Thanks.